Hello, everyone. Today we're going to be talking about cultural aspects of healthcare for older adults within your client population and why it's important to recognize and respect their unique needs and preferences. As caregivers, we should strive to provide personalized care that aligns with the cultural norms and values of our clients. According to the U.S. Census Bureau, currently there are almost 60 million Americans over the age of 65. Older adults' health and well-being also has broader implications for society. People aged 65 years and older made up 17% of the population in 2020. By 2040, that number is expected to grow to 22%. An aging population means higher use of healthcare services and a greater need for family and professional caregivers. Social determinants of health have a major impact on older adult health, well-being, and quality of life. For example, older adults with lower incomes are more likely to have disabilities and die younger. In addition, disability is likely to start earlier in life for people with lower incomes, further raising the risk of early mortality. Social isolation and loneliness are associated with a higher risk of dementia and other serious health problems in older adults. While having positive social relationships can help people live longer, healthier lives. About 8 in 10 older adults struggle to use medical documents like forms or charts, which could make it harder for them to make well-informed health decisions. Most older adults in the United States have at least one chronic health condition, making access to affordable and quality care a priority. However, factors like a lack of healthcare options in rural areas, high out-of-pocket costs, and transitions from private insurance to Medicare often complicate older adults' care. As mobility decreases with age, accessible neighborhoods and a built environment with convenient access to grocery stores and safe places to get active become increasingly important. When accessing healthcare, a person's cultural practices, traditions, and norms may be poorly understood by clinicians, and language barriers are a common source of difficulty. As a result, older people from culturally diverse backgrounds may receive poorer quality care and be less likely to access appropriate healthcare when needed. Culture is a significant factor in working with older adults, and it can impact many aspects of their healthcare. First, let's discuss end-of-life decisions. Cultural views on this topic can vary widely. Some cultures emphasize creating advance directives, openly discussing terminal diagnoses, and pursuing life-prolonging treatments. Others may have different approaches. Next, we have beliefs about aging. In some cultures, the wisdom and experience of older adults are highly valued. Conversely, other cultures may focus more on youth and its attributes. Dietary practices also differ across cultures. These differences can include how food is prepared, what foods are eaten, and how meals are served. Spiritual needs and practices are another area of cultural diversity. Some cultures may incorporate alternative medicine or unique coping strategies into their healthcare routines. Finally, effective communication is essential. Language barriers can be a significant challenge, making linguistic competence a vital part of culturally competent care. The older adult population is also more racially and ethnically diverse than previous generations, according to the Population Reference Bureau. Because the number of culturally diverse seniors is increasing, it's important that providers recognize and respect cultural differences and those patients within their care. According to the Joint Commission, it's the caregiver's responsibility to acknowledge patients' cultural, religious, or spiritual beliefs and practices that influence care. So, here's how to use that as a lens for our interactions with our patients. Acknowledge their worldview. Recognizing a patient's worldview and incorporating that into how you care for him or her is prudent professional practice. Awareness of a senior's worldview doesn't necessarily mean understanding everything about where a person comes from. It means understanding that their background, upbringing, or culture may impact how you approach your work. Be culturally sensitive and aware. Being proactive about the cultural components of your care is the best way to address your charge's needs and to ensure you can provide for them. Communication is the first step in providing individualized, thoughtful care. Ask questions. Sometimes the best and easiest way to understand another culture is to simply ask the person you're caring for. Providing culturally competent care is challenging as well as rewarding. According to the Healing by Heart model of culturally responsive care promoted by Stanford Medicine Ethnogeriatrics, there are 9 characteristics providers need to learn to foster cross-cultural understanding and maximize quality healthcare. First, be aware of the influence of culture on health status, beliefs, practices, and values. This is a simple but crucial step toward the concept of culturally responsive care. Then, increase self-awareness about your own health beliefs, practices, and values. It is vital that providers recognize the cultural influences that shape their own views of the world, health, illness, and treatment, because these will impact how they respond to other people's cultural worldviews about health and illness. Next, you will want to learn about the prevailing health beliefs, practices, and values of the cultural groups you serve. Before providers listen to their patients' needs, they need to understand the cultural group's background, including their history, social structure, cosmology, and traditional healing practices. Finally, identifying potential areas of congruity and difference between your personal health beliefs, practices, and values and those of the cultural groups you serve. Once these areas are identified, providers can accentuate similarities, find common ground to compromise, and deflect arguments in order to maximize care. Increase self-awareness about your cross-cultural healthcare ethics. Providers' cross-cultural healthcare ethics reside on a continuum, from valuing the Western system over traditional healing to valuing patients' choice of traditional healing for all patients, regardless of the Western options. Many providers feel most comfortable in a middle ground, where adults can choose traditional healing over Western healing regardless of consequences, but where families cannot choose traditional healing over Western healing for minors if minors have life-threatening conditions. Providers need to be aware of their cross-cultural ethical orientation. Now, we will discuss aspects that promote cross-cultural understanding. First, you will want to learn how to navigate cross-cultural ethical conflicts by recognizing, assessing, and addressing them, especially when they test your professional integrity. If you ever feel uneasy about a patient's requests, it might be due to personal preferences, moral beliefs, or professional standards being challenged. Tackling these issues can be tough and might require specialized help, like consulting an ethics committee. Second, develop attitudes that are culturally responsive to the people you serve. Trust, respect, and accommodation are just as important for quality cross-cultural healthcare as understanding different cultural perspectives. Third, work to improve your communication skills to be more culturally responsive. This means asking open-ended questions to understand patients' cultural needs, actively listening and reflecting, and using cross-cultural nonverbal communication. These tools can greatly enhance cross-cultural healthcare. Lastly, work to apply culturally responsive knowledge, skills, and attitudes in your clinical relationships. This final step combines self-awareness, general cultural knowledge, culturally responsive attitudes, and communication skills. It helps you ask, listen, and respond to patients' cultural needs effectively, ensuring high-quality healthcare for everyone. How can you work with your patients in a way that respects their diversity? To start, avoid making assumptions about a person's beliefs, attitudes, or behaviors based on their culture or background. Instead, engage with patients to find out about their individual values and preferences. To provide culturally competent care, clinicians can first, understand the patient's cultural background, including their history, social structure, and traditional healing practices. Second, ask open-ended questions to learn about the patient's cultural needs. Third, actively listen and reflect. Fourth, use cross-cultural nonverbal communication. And lastly, tailor cultural offers to meet the patient's needs. Now we will talk about the essential keys to providing supportive and respectful multicultural care to older adults. As caregivers, it is our duty to ensure that our patients feel understood, respected, and comfortable. This involves being mindful of their cultural backgrounds and adapting our care practices accordingly. First and foremost, communication is crucial. Address any concerns about communication early with your patient and their family. Regularly check in to ensure everything is going smoothly. Ask questions like, is a handshake or a hug welcomed in your senior patient's culture? Should they be addressed in a certain way? Are there any gestures or topics of conversation that should be avoided? Are there certain family members who can speak for your patient? Not all people have the same approach to touch and body language. To address this, talk to your patient and their family about what constitutes respectful hygiene practices, personal space, eye contact, or physical touch when necessary. Understanding these nuances can significantly enhance the comfort and trust between you and your patient. Food is a large part of one's culture, so it's important that a caregiver knows their elder patient's food and eating customs. Ask your patient or their families questions like, are there particular foods that should be avoided? Should mealtimes be scheduled for certain times of day? Are there any holidays in which special foods are required or fasting takes place? How is food prepared and served, and are you expected to prepare and serve in a specified way? Beliefs about medical care and spirituality can have a strong influence on your elder patient's approach to life. For example, other cultures may have different times of the day that they pray, and during those times it would be inappropriate for them to be disturbed, even for doctor's appointments or other care needs. In conclusion, providing supportive and respectful multicultural care to older adults requires us to be attentive, adaptable, and empathetic. By understanding and respecting their cultural practices, we can offer care that is not only effective, but also deeply respectful and compassionate. Cultural competence is not an isolated aspect of medical care, but an important component of overall excellence in healthcare delivery. Issues of healthcare quality and satisfaction are of particular concern for people with chronic conditions who frequently come into contact with the healthcare system. Efforts to improve cultural competence among healthcare professionals and organizations would contribute to improving the quality of healthcare for all consumers. Several organizations have instituted cultural competence guidelines for their memberships. For example, based on 10 years of work, the Society of Teachers of Family Medicine has developed guidelines for curriculum material to teach cultural sensitivity and competence to family medicine residents and other health professionals. These guidelines focus on enhancing attitudes in the following areas: awareness of the influences that sociocultural factors have on patients, clinicians, and the clinical relationship. Acceptance of the physician's responsibility to understand the cultural aspects of health and illness. Willingness to make clinical settings more accessible to patients. Recognition of personal biases against people of different cultures. Respect and tolerance for cultural differences. Acceptance of the responsibility to combat racism, classism, ageism, sexism, homophobia, and other kinds of biases and discrimination that occur in healthcare setting. If you have any interest in learning more, the references to this training have been provided. Thank you for completing this module.